When we started the initial process of finding out our son's diagnosis of spina bifida and what that would look like, Children's Hospital set up a family consultation meeting for us, and we got to meet with everybody all at the same time. We didn't have to spend days trying to consult with different specialists, and we basically had a 2-hour uninterrupted window with some of the best surgeons and specialists even the country has to offer, to discuss our son's situation, what our options were, have any questions that we had get answered, review our tests and our MRI, just the knowledge base that was in that room. I mean, it was just a panel of a conference room, a team of doctors that we had available to us to help us understand our son's situation and the options we had to proceed. And there was a lot of processing we needed to do afterwards, but anytime we had a question come up, we were able to call and get a hold of somebody immediately and ask whatever questions we needed to and get them answered. And if the nurse on the phone didn't have the answers, she got them very quickly and got back to us usually within the same day, just to help us in that process to figure out what we wanted to do as quickly. Obviously, we didn't have a very big window until we needed to have that prenatal surgery. And they were amazing at helping us figure out what we needed to figure out in a timely manner. There's different benefits and different risks, and you sort of have to weigh these scales of percentages. There's a 30% chance of a benefit for this and a 40% chance of a risk for this other thing, and what makes the most sense. And at the end of the day, every family just has to make the decision that's best for them. We were well prepared going into it that we could have all of the risks and none of the benefit. And to this point, we've been very lucky. We've had very few of the risks actually come to fruition. Our son was slightly preterm, but he wasn't as early as he could have been, having had the surgery. And I was at higher risk for some different things, and none of that happened. And our son has had some great benefit from having had the surgery. I realize not everybody gets to see that benefit, but we really did, and we know that we made the right decision for our family, even though the road has been hard. We're looking at the lifelong benefit to our son's life, and we believe that we really made the best decision that we could. When I got to see him, I didn't actually get to hold him because I was still sort of strapped to the C-section table. But when I first heard him cry, I couldn't see him. He was on the other side of the sheet. And I just started to cry, hearing him cry. And then when they brought him out to me, and I got to see his sweet face for that first time and kiss him and know that he was okay, And the first time I got to hold him was after he was already in the NICU. My husband got to be with him the whole time once they took him away. But it was several hours before I got to actually hold him for that first time, and it was so special. And even though he's in the NICU and he's got wires and cords, they don't limit my ability to be able to have that time with him, to hold him and hug him. And it's just been so special every time I get to hold him. But that first time when I just got to see his face and explore all of his features and see that he's okay, it was really so special.